Welcome to another edition of This is Public Health, a podcast from the Illinois Department of Public Health. In this edition, we're focused on data modernization and how improvements in gathering and utilizing data will have a big impact on public health programs and outcomes in the years ahead. Our guest for this edition, Dan Jovanov, Public Health Informatics Section Chief at IDPH, and Dr. Abel, a professor of medicine at the Feinberg School of Medicine at Northwestern University, also the founding director of the Center for Health Information Partnerships and the Institute for Artificial Intelligence in Medicine. Thank you both so much for being here. Dan, we want to begin with you, and I want to start with defining some of the terms we're talking about, beginning with informatics. You are the section chief for informatics here at IDPH. So what does that mean in the public health arena?
So Jim, I want to first thank you for inviting me to be part of this podcast. It's really my pleasure to discuss our DMI efforts. So public health informatics is fascinating and increasingly important field. So it's joint application of information technology and data science to improve health outcomes. So it encompasses the collection, management, analysis, and dissemination of health data to support decision-making, policy development, and the implementation of the public health initiatives. So it's all about transforming raw data into actionable insights that can make a real difference in people's life. So it's a little bit overwhelming, right? So let me try to simplify by telling you one personal story. So when the COVID pandemic started, like many others, I found myself working from home. As you know, I have 3 monitors, a docking station, laptop, so I need a bigger space. So I set up my makeshift office at our dining table, thinking, this will be all done in a few weeks. So my son, the third grader at that time, started overhearing unfamiliar terms in my work conversation, like data, APIs, visualizations, epi curves, and so on and so on. So one evening, as I was tucking him in, he asked what I do work, and right off the get-go, I'm like, I'm a public health informaticist. But his blank stare told me I should try again. And I start thinking, and I try again, and I start imagine that I'm a superhero detective who uses computers to catch sneaky germs before they can make everyone sick. So I take these boring numbers and turn them into cool picture visualization that shows where the germs are hiding. So I then help doctors and scientists use these magic pictures to keep everyone healthy and stop the germs that are making the mess in our towns.
I love that analogy, and it really it perfectly sums up what we're doing here. A lot of technical and sometimes complicated terms, but the idea is to translate it into real-world outcomes. So, Dr. let me ask you a bit about that process, and how do we take these informatics, all of this data, these mountains of numbers and factoids and things, and translate those into better outcomes?
Well, thank you again. I'd like Dan, I'd like to thank you for having me on this program. So, one of the really important lessons you learn in informatics early days is that it's always not just about the technical, solutions to these problems, but where informatics really shines and is successful is when you're able to also combine that with a deep understanding of the underlying processes, the people involved, the values, the real problems you're trying to solve, and you're able to take all those data and make sense of them and essentially tell compelling stories that point you to very clear solutions. I think that's a really key thing, is a lot of informatics, successful informatics, involves the interplay between data, people, processes, and the problems that they're trying to solve.
As we noted at the beginning, one of our focuses here is on data modernization, not just the gathering of data, but how do we improve that process. So, Dan, let me ask you about this process of modernizing public health data systems, and how do we ensure that modernized systems effectively support good public health decision making?
So yeah, you're right. The Data Modernization Initiative, or DMI, it's a hot topic. So it's a federal effort led by CDC to revolutionize our state public health data system. So think of it as a giving our public health infrastructure a much needed digital makeover. So the DMI focuses on 5 key priorities to enhance our ability to tackle current and future health challenges. So I will go over all 5. So the first one is building the right foundation. So we are upgrading our data collections and analytics tools, moving to the cloud-based services for real-time information. So it's like giving our health departments a turbocharged engine to keep pace with any health crisis. So the second key priority is accelerating data into action. So we are not just collecting this data, we are turning it into actionable insights. So by leveraging diverse data sources and advanced tools like AI, we are supercharging our ability to respond to outbreaks, predict trends, and just promote health equity, right? So the third key priority is developing a state-of-the-art workforce. So we have this supercharged engine, but we need people to drive it. So we are investing in our people, ensuring they have the skills to navigate this new data landscape. It's all about building a team of data superheroes who can transform numbers into life-saving strategies. So the fourth key is supporting partnership. We know we cannot do this alone. We need other people to be involved. So by fostering collaboration with various organizations and communities, we are creating a network of health advocates ready to tackle challenges together. So this is bringing us to managing change and governance. So we are keeping a close eye on our progress, ensuring resources are used effectively and adapting to new ways of thinking. So it's all about staying agile, nimble in ever-changing public health world. So in essence, I'm seeing DMI as our blueprint for a modern, responsive, and collaborative public health system, one that is prepared to face whatever health challenge the future may bring.
You hit on a couple of key points that I want to come back to in just a moment, but you used the key phrase, and one that will get a lot of people's attention: artificial intelligence. Dr. Abel Coe, who is a founder of the Institute for Artificial Intelligence in Medicine, that's a pretty fraught term these days. So explain, if you would, what do we mean by artificial intelligence, AI, in this setting? And is it something that, as some people have suggested, maybe we should be a little bit worried about as artificial intelligence seems to at times take on a life of its own?
Actually, Jim, if you don't mind, I might go back and just add a little bit onto what Dan said, because I
Please.
think it's really important about data modernization. And one of the things that I think Dan really effectively highlighted is that, it really is about these collaborations. And one thing the COVID pandemic showed us is that we're all in it together, whether we want to be or not. And so when you have really successful public health initiatives, oftentimes it's invisible. But when we're really under, threat like a pandemic, everybody realize they have to pull together. And I think one of the exciting things, like even about this podcast, for example, is that we find that in order to really get effective workforce, you oftentimes have to build collaborations across groups. So just the fact that we're having this conversation between academics and public health, so you might have healthcare institutions working more closely with public health, you might have industry partners. All those are absolutely essential, because we're all in it together at the end of the day. So I just want to emphasize that it's super important. Regarding artificial intelligence, I think it's important to recognize it's been around for a long, long time. But the reason that it's, in the fore of the public today is because, we've basically seen things like ChatGPT, these large language models emerge, in the 2022 or so. And since then, the easy accessibility, the ability to interact with these tools so readily has really transformed the way we think about the potential for artificial intelligence. Now, people, as you pointed out appropriately, are a little bit nervous. In large part, I think that's because, I'll be honest, AI has had a bad publicist. If you look at every sort of lay person exposure to AI through movies, it's always out there to kill you. It's going to kill you either, now or in the future. So I think there's always concerns about that. There are legitimate concerns too. I think that, some of the artificial intelligence tools out there, people think, well, they'll replace my job. It's going to, I won't be needed. Even white collar jobs might not be safe. But what we're seeing is actually an amazing potential, and the current applications, certainly in healthcare, are very much augmenting or improving the processes that we have currently in healthcare, helping to offset some of the clinician time, taking over basically low-grade secretarial work like taking notes, that sort of stuff. So I think that in the near term, certainly, and we think in the long term, AI is going to be a real help to allowing people to get away from what is low-grade tasks and function at a much more human and personal level.
You're listening to This is Public Health with the Illinois Department of Public Health. Our guests, Dan Jovanov, Public Health Informatics Section Chief at IDPH, and Dr. Abel Coe, Professor of Medicine at the Feinberg School of Medicine at Northwestern University. Dan, I want to come back to you and something you touched on a little bit earlier, but it's really important and maybe one of the more complicated aspects of data modernization, the fact that public health is decentralized here in Illinois. We have our big state agency, but we also have dozens of local health departments and a lot of other agencies and organizations that work in this arena, and they all have different computer systems and software. So how big a challenge is it to get those systems to communicate with each other efficiently and effectively to be able to exchange that data?
So, returning to the story of my first question about my son, he thinks that we are Avengers, but for math. So, and informatics is Avenger technology for math. So, yeah, the centralizing system that are not communicate effectively. It's similar to teaching a room full of people who speak different languages to have a coherent conversation. So it is a significant challenge, but one that we are actively addressing. So let me break down some of the key issues that I'm seeing. So imagine a tower battle, like with just built with computer systems. So we have a wide variety of systems, software, data standard across different agencies. It's like trying to fit a puzzle pieces from all these different sets together, but they were not designed to connect seamlessly. So imagine next picture, data silo. Not the farm kind, but isolated pools of information. So many agencies and even programs within the agency operate independently, leading to very fragmented data. It's like trying to solve a mystery with only parts of the clues. Interoperability is our holy grail. We need systems that can exchange and use information seamlessly. But standardizing across numerous agencies with different priorities and registries is like herding cats. Challenging, but not impossible. So we are also dealing with legacy systems. Upgrading this system is often costly and time-consuming, but necessary for progress. Security and privacy concern, another end. So, and then add another layer of complexity. We need to ensure data is exchanged securely while maintaining patient privacy. It's a delicate balance. Funding?
I'm sorry, please finish. Go ahead.
Yeah, funding and resources are often the elephant in the room. So modernizing system requires significant investment and expertise, which can be scarce, especially at the local level. So finally, coordination and governance are crucial. Without clear leadership and guidelines, it's like trying to conduct an orchestra where each musician is playing for different sheets of music. But there's a good news. We are not just identifying problems. We are actively working on solutions too. So we have created this informatics platform that we call the IDPH Data Hub. Think of it as a universal translator for our various health data systems. So this hub standardizes and normalizes data from different systems, creating a common language for our health information. We have built APIs Think of that as a diplomatic ambush to connect these disparate systems. And we have developed a master patient index, which is like super smart ID card that help us uniquely identify records from the same patient across different systems. It's complex task, right? There's no doubt, but one that's crucial for creating a more responsive and effective public health system.
And you come up with some of the best analogies to explain these very complicated issues. And it's a reminder again that all the technology in the world is great, but it does ultimately come back to people and the ability to analyze and interpret this data. Dr. Ko, you touched on this earlier, but talk if you would a little bit more about creating a public health workforce for the future that is literate in this type of technology and is able to use it for the best and most efficient deployment of public health resources.
Yeah, so first of all, let me just applaud Dan. First of all, I've always enjoyed working with Dan. We've worked together, I think, on and off for 15 plus years through the pandemic, et cetera. And forget AI, what we need is cloning technology because we need more people like Dan. I think Dan is somebody who's been able to navigate both the complex technical aspects, but as you can see, can really simplify it, tell a compelling story, and figure out how to navigate through complex processes and competing priorities at different institutions. So I think I just want to applaud Dan as one of the heroes in public health here in Illinois. We need more people like Dan. And that means that we have to build a pipeline. It's like Dan said, we have to have resources, but there are a ton of really excited young people who can be inspired and are inspired to work for the benefit of the public. We see them all the time. They come through our public health programs. They come through the schools of public health, of which there are, like UIC being a big one here in Chicago. They come through PhD programs. So I work with a number of students who are both medical students and PhD students and master's students. And many of them come to me and say, how do I get involved in some of these projects? Projects like the impact of things like policy on health outcomes. They want to be involved in projects to monitor the health of populations. They want to understand about novel technical means to link data to create new insights or tell compelling stories around data. So I think that there's a lot of, and we can do a better job of partnering up many of our academic efforts with the public health efforts that are already in flight. And I think stories programs like this that help tell compelling stories and expose people to, people doing great work, hopefully helps inspire a generation to come in as well.
We are nearing the end of our time here, but I want to end on a positive note, the fact that this issue is so important that it is at the heart of a multi-million-dollar public health infrastructure grant that was awarded to IDPH. Dan, if you would explain how that funding is being utilized.
The FIG grant is supporting the DMI, right? So, and we have initiated 20 plus projects tackling like 5 key priorities that we already talked about. So just to continue the conversation that Abel had about the workforce, so I will start with the developing of state-of-the-art workforce. So we are investing in our people to create a forward-thinking, data-savvy workforce. So this includes strengthening our informatics and data management team, like rolling out comprehensive data literacy, partnering with academic institutional people like Abel and his programs, right, to build a robust talent pipeline. We need people that are finishing the public health schools ready to jump in this new technology, working with data and AI and the technology that we are building. So our goal is to ensure our team is equipped to tackle the public health challenges of tomorrow, not just today. So going back to building the right foundation, we are laying the groundwork for a robust public health data ecosystem. So this involves conducting comprehensive data maternity assessment, transitioning from outdated data warehouses to very flexible data lakes, and implementing FHIR for rapid data exchange. So we are also expanding our master patient index and harnessing AI to streamline process and enhance our predictive capabilities. Partnership. So collaborating is the heart of our approach. We both emphasize that, me and Abel. So we established a DMI advisory committee with local health departments representation, and we are partnering with the state Medicaid agency, HFS, on crucial projects. We are also working closely with organizations like the Public Health Informatics Institute and university research groups to share best practices and strengthen the workforce capacity. So our improved data sharing process ensure that the local public health agency and other partners, researchers, have the information they needed at the time they needed to protect community health. So, and for all this to keep us on track, we set up a data governance overseeing data management across the agency. We established the DMI advisory committee providing strategic guidance. So we have implemented adaptive policies to accommodate future innovation. So with all these projects, there's too many to mention all, right? We are creating a modern, responsive, and collaborative public health data system ready to meet the challenge of today and tomorrow.
Dr. Coe, I want to give you the last word here to break out your crystal ball for a moment, to look into the future. Where do we go from here, and how do you see this impacting public health here in Illinois and around the country?
Sure. So first of all, I have to acknowledge that the work that we're doing here in Illinois, we are very much aligning it with national efforts. I want to be clear. So I'm fortunate. I currently serve on the Data and Surveillance Work Group for an advisory committee to the director of CDC. And if you go on their website, you'll see a series of recommendations around workforce and around data standards. We are very much aware of those and tracking those and making sure that we're aligning with those national efforts. So I think that, as Dan pointed out, it's going to be really important to change public's perception, I think, of the importance of public health. I think that the policymakers are going to be crucial because, as Dan pointed out, resources are absolutely necessary. We'll get resources, we believe, from similar national efforts, but there has to be excitement and resources available locally. And so I do think with the alignment that we're seeing in Illinois, with the efforts that are happening both in academia and also with the national efforts, we're actually in incredibly good positioning. I think that the excitement is high. I think we've got great people at the helm. I think there's a real opportunity for Illinois to come out of this as a leader in public health modernization, and we're excited to be part of that team.
I want to thank you both so much for sharing your time and expertise with us here today. Our guests, once again, Dan Jovanov, Public Health Informatics Section Chief at IDPH, and Dr. Abel Coe, Professor of Medicine at the Feinberg School of Medicine at Northwestern University, Founding Director of the Center for Health and Information Partnerships and the Institute for Artificial Intelligence in Medicine. Again, thank you both so much for being here, and join us next time for This is Public Health with the Illinois Department of Public Health.